Hey, this is Russ. I want to talk a little bit about our knee and also about other joint issues, okay? Because I can't be the only one with just these issues. But before I talk about that, I want to talk real quickly about my haircut, all right? As you notice, I got a haircut, and this is not the first time that my wife has cut my hair. This is about the 11th time that she's done it. And I think she's getting pretty good at it because she's moving pretty quickly now. She kind of knows what she's doing, and it moves really fast. So, anyways, I wear this I don't know what you want to call this device that I'll put a photo up here for you to see, and it catches the hair, okay, and so and then I have like I don't know, kind of like a throw, what would you want to call that, a bib, an apron, I don't know, a cape. Yeah, okay, it's a cape. Trying to come up with the word. So I wear all this stuff, and then of course I take it off, and then I sweep the floor after when she's all done and everything like that. So I'm putting things together and getting ready to dump it into the little garbage can, and we do this upstairs in the area where our bathroom area is, because that's a tiled floor up there. And so I'm sitting on the chair, so I have to move to do this, and of course as I move, what happens? I bump my knee into the cabinet handle. Now, here's the thing. You would think you have a metal knee, you shouldn't hurt, right, man? But that thing hurt. I can feel it still today. So, yeah, we got to be careful. Every little thing kind of just messes us up all the time. So, yeah, it kind of reminded me that, you're not, just because you have a metal knee, it doesn't mean anything. You still feel it, okay? All right, so let me talk about joints and things. It's not the only thing that hurts. It's not just the knee. I've had like tennis elbow. Have you guys had that before? Yeah, it's not from playing tennis. They call it that. But on occasion, I still feel that, okay? And I think a lot of times it's because sometimes, I think for mine, I was working at a desk thing for many years, and so you put your arm down when you're moving the mouse and things, and then I think you kind of rub your elbow sometimes on it. So I was having those issues, and I had some carpal tunnel issues too from using the mouse a lot, because you're kind of putting pressure on your wrist area as you're doing it. So a lot of people who use a computer a lot, have these type of issues. Other joint issues I've had is recently, in fact. I had a trigger finger. You guys know about that one, right? On the right hand, my third finger sometimes just pops, right? But it's actually been getting better. I haven't really done a whole lot for it. I was using this gua sha thing before, which was basically a metal object that you help, kind of like massage the area of it, and that helped for a while. And then I just kind of stopped doing it altogether. And so I don't put it in any type of finger brace or anything like that anymore. And I find that it's actually getting a little bit better. Now, it's not totally gone because I can feel that, okay? I find that it's just easier just to let it go. And then I just kind of, every now and then you'll see me doing stuff like this. Fingers sometimes have joint issues too. If you use your hands a lot, that becomes an issue for you. So little areas besides our knee also have issues. Now, the knee, of course, has been our biggest issue because that's major pain. And if you watched yesterday's video, I mentioned that I had some abdominal pain, and then I believe that's from kidney stones, okay? So I don't know if that kidney stone is gone or not, but I'm feeling okay right now. I will tell you this, as much as that hurts, the knee replacement hurt a lot more, all right? It's two different areas of your body. Feeling it in your abdomen is painful, okay? But I was functioning along, waiting for that thing to either pass or doing something. But I'll tell you, that knee replacement pain, to me, trumps the abdomen pain. If you had both of these things, let me know what you think. But I think that knee pain, because, that's something you have to keep doing all the time to rehab that thing back. Realistically, it took me about a year and a half. I call it 2 years plus because that's how long it's taken. But, I think it was at least a year and a half before I was able to get onto the bike and, start working on it. I wasn't perfect, but it took a long time. It's not something that happens, overnight. It's a slow, long process to get your knee back to the way it is. And as we go through all that, the physical therapist is pushing on it, and I'm screaming in pain. So it's, in my mind, it's a tougher pain to deal with because it goes on for so long. At least with the abdomen pain with the kidney stone, it's there for maybe a day, maybe 2 days, and then it's gone because we work on it and we get rid of it. Okay. So in my mind, I think I'd rather have the kidney stone pain than the knee replacement pain. So anyways, let me know what you think, if that's something that happens with you. And of course, other joint areas, of course, have problems too. I mean, if you've had, I don't know, almost just about anything that has a joint, you can hurt that. So it's just something that kind of crossed my mind as I was thinking about, my knee pain after running into the cabinet, and then I was thinking after the abdomen pain, I says, which one's actually worse? I'd have to say it was the knee pain. Now, some of you guys may have gone through hip replacements and things like that. If you've done a hip replacement along with a knee replacement, let me know which one you think is worse. Now, I've heard from many other people, and they said that the knee replacement is worse than the hip replacement. Is that true? The people that I've known that have gone through hip replacements are usually back and running after several months. But, knee replacement people can be like that too. But obviously, yeah, I wasn't so lucky. It took me a lot longer. But I know my hips got issues. I think it does. Doctor, told me before that it didn't. It's been quite a few years since he last x-rayed it, but I think it has issues. I mean, I think it's at the point now where even though I can feel it in both knees, I think I feel it more in the hips than the knees if I'm walking some long distances. So people have said you're just walking weird because of your knees. I don't know about that. I mean, the hips stop me more than the knees at this point. All right. Anyways, just some rambling, some thoughts about various joints. Let me know about this hip thing. Anyways, if you liked the video, go ahead and hit that like button, hit the subscribe button, and I'll talk to you guys next time.